So, in this video, I'm going to talk about the Indian hospital sector. So, the question that I want you all to think about is why the X ray of our chest costs more than the X ray of our knees, because the machine is the same, the x-ray particles are the same, the x-ray plate is also the same. So why there is a difference in charge? This is because the hospitals are running towards profitability. They are running to treat diseases and not prevent them. It is much more beneficial for the hospital to treat a cancer stage 2 patient than to prevent cancer by screening and giving healthcare to a patient who has just developed the symptoms of cancer. So why the hospital sector is in such a state, and also the experience that we get while going to a hospital is also something that we needs to discuss about. The queue system is pretty much bad. Yeah, even if you go to super specialist hospital, in a private, you have to wait for 1.5 hour to get your doctor's appointment. The prices are just such that doesn't make sense. So why not even a single hospital works for the welfare of the patients? This is because of the inherent nature of the hospitality itself. There is a huge capex involved. For establishing a hospital, one need to invest about 50 to 100 crores of rupees that they take loans from banks, and when the times comes to pay the interest and the principal, so it's when they get the they develop this profitability aspect. So what can now be done in order to improve the hospital sector? So here are few such initiatives that few startups have already started to take in order to take care of this. The first of which is moving doctors from being consultant to recruiting them as full-time employees. Like other sectors, like utility sector, be it electricity or water management or any other, even both private and public, the employees there are hired for on a full-time scale. They are not hired as agents or someone on commission. But in the healthcare segment, it is completely different. The doctors are hired as consultants. They are paid as per their performance, the number of patients they are operating, the number of patients that are visiting them, the bills, the tests that are the volume of the test that they are prescribing. So because their incentives are linked to the number of tests and charging as much as from the patients. So such a system is creating a phenomena where doctors are prescribing unnecessary tests, and also they are not interested in taking preventive measures for the patient but to treat the sickness. So this can be avoided by taking up doctors on a full time role, and avoiding such incentives where their pay is linked to the number of patients that get admitted or the number of tests that are prescribed by them. So this is the first change that can be taken care in the healthcare segment. The second is, instead of building such a super specialty hospital at once involving huge capex, what healthcare people can do is they can build small hospitals or healthcare units, catering to specific needs of the patient. And that will help to keep the capex less and provide quality care for the patients. Like earlier there were concepts of nursing homes, which where doctors used to visit, and the expenses were not that much. So they can focus on building specialized centers that are not that much capex heavy. And the third is linking their healthcare business with the insurance business, because what is happening is hospitals are much more interested in treating and extracting as much amount of money as possible from the patients, but the insurance sector is one that benefits when the patients are healthy. So if the hospitality and healthcare sector also provides insurance combined with the healthcare services, then be having healthy patient will be beneficial for them also. So here the incentive will be to keep their patients healthy, to screen them early, to create awareness and build the nation having a healthy workforce. So these are the few structural changes that can be incorporated in present context, which will be beneficial for the customers. I know saying is very easy, implementing is very difficult, and there are a lot of constraints involved in this, like who is actually doing business on the ground. But something needs to change, and that change can be very small as well. Few startups are doing, and hopefully this thing can expand in future for the entire country. Thank you.